So survivors really have a unique set of needs that is different than patients that are undergoing active cancer treatment. And to meet those needs, we have services through the Palliative and Supportive Care Clinic, including nutrition support, and they can really help patients make that transition from active treatment into survivorship and making sure that those needs are met. In addition, I think it's important to highlight that palliative and supportive care is something that should be integrated from the time of diagnosis to provide that relationship over time and that extra layer of support that's so important to patients.
Oncology is one example where we know that survivorship for patients is changing and patients are living longer, but not only with oncology patients, but other patients such as those with dementia, congestive heart failure, end-stage lung disease, kidney disease. Medical technology and science has progressed and multiple more medications that allow patients to live longer. But what we strive to do is help the patients live longer with a higher quality of life as they survive with their disease. So having the interdisciplinary focus, increasing the involvement of the families, and having the patient's wishes and their goals help set the plan of care is extremely important, and that's what palliative and supportive care does for survivors and their families. Over the past decade, UAB Medicine has been a national leader in promoting the integration of palliative care into the fabric of the medical culture. So for the past 10 years, there has been a significant emphasis, knowing the demographic of our patient population, again, that patients live longer, that patients and families are more complex, that our family dynamics and the psychosocial stresses of living in the year 2015 promotes the concept that we should, across the spectrum, take care of the patients at every setting. So over the past decade, UAB Medicine has made a significant contribution and a significant investment in providing the locations and the model of care and bringing the expertise into our healthcare system to provide the level of care for patients and families across their illness spectrum, from the time of diagnosis to the time of advancement of their disease.
I would add to that the importance over the last several years of integrating the palliative care team into the clinician's practice. And really, there's been a tremendous amount of education that's occurred between palliative care and oncology to really enhance those principles in our general practice as oncologists as well.
Additionally, UAB as an educational and academic institution has worked very diligently to integrate principles of good symptom management, interdisciplinary care, excellent communication, patient and family-centered care with our learners and with our faculty and staff to improve the overall experience and improve the continuity of the experience and care plan for patients who have advanced complex illness, such as oncology or heart failure or end-stage lung disease, dementia, etc. So that's what our health system is doing to promote and to integrate palliative and supportive care throughout.
So one important component of supportive and palliative care is that it really provides the patient an opportunity to maximize their functional status. And that's very critical in the oncology world, where the ability to take additional treatment is dependent on how well you're functioning and how you can get around your house and what your current health is. So providing that additional symptom support and functional support can be very important in treatment of cancer patients.
It's really key, like Dr. Rocque said, it's very important to make sure that as we assess patients at any stage of their treatment, from the time of diagnosis throughout their treatment, that we realize there may be some functional limitations that patients have as a result of their treatment, whether it's due to the surgical changes that their body now has undergone as a result of their treatment, whether it's the late stages of radiation treatment or chemotherapy or some of their curative treatments. But we think of that more in the mode of maintaining, again, the highest functional status, and not in the traditional framework of rehabilitation, but more in the maintaining functional status, keeping the quality of life, maintaining the patient's ability to function as a member of their family, as they define their work expectations, etc.
And in addition to things like physical therapy, there are also often other tools that we can use to really maximize on people's quality of life after they've had a cancer diagnosis.